Thank you very much, Ginevra. So we are going now to move on the discussion session. So we have with us three panelists. I'm very happy to welcome them. They are all online. So first we welcome Mr. Marcus Kujawa from the Standing Committee for European Doctors. Good morning, good afternoon, Marcus.
Good afternoon, and thank you very much for the invitation and all the very interesting presentations. So I'm from the Standing Committee of European Doctors, CPME, and we are representing the national medical associations across Europe.
Excuse me, Marcus, I would just want to present the two other panelists before we start the discussion.
Sure.
I will also welcome Georgia Orfeanu from the Cyprus Association of Counsel, Patient and Friend.
Good afternoon, Georgia. Good afternoon, everyone. Thank you. It's a great honor.
And we welcome also Bolette Sobor from the Danish Health Authority. And Bolette is also sitting in the Member State Committee of the EU-JAV. So good afternoon, Bolette.
Good afternoon.
Okay. Thank you for three of you to be there. So I will start maybe with you, Marcus. As your institution, as you mentioned, it is co-chairing the Coalition for Vaccination. I would like to know how the work performed by Grit and colleagues on healthcare professional training is important and relevant for your coalition and for you. And do you have a view for continue and sustain this work inside the coalition, for example?
Thank you for the question. So indeed, yes, CPME is co-chairing this coalition for vaccination, which has been mentioned now today for a number of times. We do it together with the European Associations of Nurses, they are called EFN, and the community pharmacists, they are called PGEU. And it was already mentioned in the morning, I think, that the coalition, it was originally convened by the European Commission in 2019. Nowadays, at the moment, it brings together almost 20 European associations of healthcare professionals, different healthcare professionals, not only doctors, nurses, and pharmacists, but we have also midwives and dentists and physiotherapists as our member in this group. And yes, so the coalition is currently supported by an EU-funded project called Immunion. This was also mentioned by actually our project coordinator, who was one of the panelists in the morning session, and now by Grit also in her presentation, as the University of Antwerp is also partner of the Immunion project. So if I think what is relevant and useful for CPME, but also for this coalition for vaccination, I can go maybe back to the first part of the Grit's presentation. Because last summer, related to this Immunion project, we conducted a survey with a similar objective to find out healthcare professionals' views on their vaccination training needs. And here, as Grit already mentioned, we actually used the vaccine training barometer developed in the EU joint action as a basis for our own survey. So of course, we tailored the questionnaire and the questions to be suitable for our needs and the purpose of the Immunion project. And I can say that the results of this survey, they were very similar compared to the assessment made in the EU-JAV. We received over 3,000 responses from, I think, from all the EU countries and from outside EU as well. And also for us, the main finding was that there is clearly a need for additional vaccination training for many healthcare professionals in Europe, and that the majority of them are willing to follow extra courses. Then what comes to the part 3 of your work on developing standardized training curriculum and guidelines, I think all the 8 modules looked very relevant. In our Immunion survey, we asked healthcare professionals what are the most frequent topics of the questions that they receive, and they seem to center around vaccine safety and side effects, but also around effectiveness and the working mechanisms of vaccines, and also vaccination schedules, national and regional. And we saw that the third module you showed earlier today, it addressed vaccine safety and vaccine development. And the fifth module was about immunization policies and schedules. So particularly, I would say that these two would be very relevant when it comes to the training needs of healthcare professionals. Another thing I find relevant and useful is the module 7 that you showed on understanding active listening and communication about vaccines. This topic has been discussed lately, I would say quite a lot, that how could healthcare professionals communicate better about vaccines and vaccination. And we have seen that there are European countries where vaccination is not really addressed enough in the curricula. And I would say that this communication aspect even less. And therefore, actually, as part of this Immune project, the University of Antwerp is coming to CPME's next General Assembly in 2 weeks to organize this kind of special session on communication around vaccination. And I have to say that we are pretty excited about this and looking forward to seeing how it goes and to see what is our members' feedback on it. And quickly to the second question, how all this work can be continued and sustained. I feel that often this kind of EU projects and joint action, maybe they are somehow forgotten after the final payments are made, because there's no simply people who are assigned to take care of the follow-up actions. But fortunately today we already heard that you have some plans how this work can be continued and how these results would be disseminated at first, because I think the first step is really to let people know about the results of this joint action. And I think we have discovered sometimes that the information of different joint actions and European projects, they don't really reach the people at the national level. And this is why we have actually invited now Work Package 8 of EU-JAV to tell more about the results to this upcoming General Assembly that I already mentioned. And I think that will be very interesting for our members to really hear from you directly. And we are looking forward to that. Maybe I stop here and
thank you, Marcus.
give the floor to the next one.
And thank you for your very important and useful comment. Maybe Grit, you want to add something?
No, I only want to mention what Marcus already said. So we are working in union where we take all what we learned and what we created in the joint action. We take it with us and really develop tailor-made actions based on what we did in the EU-JAV. And this tailor-made is one part. We are creating a train the trainers module based on the curricula, but we also are doing in the CPMA, for instance, a meeting. We are doing a side session from where we are focusing on the communication, and this is really on the module of communication of the curricula. We took it and we create there really a session, and we ask people like Eddie Larsson, but also Stefan Lewandowski to come and to talk about communication, how to communicate, very concrete for the GPs, how to communicate about vaccines. That's in fact what we are doing now based on what we learned out of the work in the EU-JAV. So we really created, I think, something very sustainable, and we want to push it through other European projects. That's our next step, in fact.
Thank you very much, Grit, and it's very concrete also. We see the concrete consequences of your work. So thank you very much, Grit. So now I will turn to Ms. Georgia Orfanou. Georgia, as a representative of Patient Association, I would like to have your view on the type of communication that ECL has launched during this joint action toward young people. And in particular, do you think that this kind of school competition can be replicated by your association or other associations of this kind? So please, Georgia, if you can comment on this.
Of course, thank you very much. Dear Jean and Grid, congratulations and thank you, because both of the projects are commendable, they're important and they could be useful to me and to my colleagues at BASICAF, especially for those of us in the social marketing department, as we work on cancer prevention programs, and HPV elimination is one of them. We strive to create awareness about cancer and to make a positive impact on social behavior as regards cancer prevention and early detection, and as regards wellness and quality of life. And now as a marketer, I want to be curious and I want to learn and to be inspired and to add value to what I do. So for starters, I have to say that I love the slogan, be wise, immunize. It rhymes, it's creative, it's motivational, and it also serves as an inspiring reminder about the power of wisdom and knowledge, which, if I may add, wisdom and knowledge are greater than any war weapon. And if I may, I need to say that it is extremely sad nowadays to watch the loss of life and the distraction brought up by the war. And may the leaders of all the countries involved to be given the wisdom and the peace at heart so that the loss of life is prevented and the distraction of the civilization is averted. May God bring peace to Ukraine, Russia, and the whole world. For the greatest prayer of humankind asks not for victory, but for peace. Now, being in the field of social marketing and specifically in cancer prevention and control, I would also copy Kofi Annan and repeat his words that it is our duty to make peace with cancer. And according to the European Center for Disease Prevention and Control, the ECDC, the EU's annual incidence rate of human papillomavirus is 33,000. with a mortality rate of 15,000. The good news is that there is primary prevention about it, as we know, being the vaccination, which is one of the most efficient ways to prevent the virus. Nonetheless, full coverage remains extremely low, with a universal coverage falling well below 90%. And this applies to Europe, and it also applies to Cyprus, as a result of the COVID-19 pandemic. So communication that leads to engagement is crucial. And I'm really pleased to hear that the Be Wise, Immunize competitions have successfully met the KPIs despite the difficulties you had, the KPIs that were set, and had the traits of a successful social marketing campaign. Such as a well-defined target audience. The goals were clearly defined. The message was highly targeted and consistent, and the use of integrated marketing communications was highly beneficial, as I've noticed, because it helped to build the brand's image. It created an experience for the audience. It reached out to new audiences as well. And it probably generated cost savings too, right? Now, in addition, I've seen that the communication strategy was clear, concise, concrete, correct, and coherent. So this adds to the adaptability of the project. And in other words, it enables the project to be easily adapted and replicated by other associations interested in doing so. And well, as far as BASICAF is concerned, and as I've already mentioned, one of our major projects since 2010 is the elimination of HPV and its related cancers. And we're really proud that a part of this project was the first winner of the NGO category of the 2020 EU Health Awards, titled Promoting Vaccination in Children. Hence, the project Be Wise, Immunize could contribute to our program as a tool to enrich our communication with teenagers and to help us engage with them effectively. These are my comments. Thank you.
Thank you very much, Georgia, for this comment and the role you had for this complex situation we live actually. Okay, thank you very much. I will maybe ask Ginevra if she has an additional comment.
Thank you. Just very briefly, I wanted to thank Georgia both for making the time to be here today. Pasikav is one of our valued members of ECL, and also I appreciate the kind words coming from an experienced social media marketers. As mentioned before, ECL is quite a small organization. We are a small secretariat of 4 people, and I lead most of our internal and external communications. And I'm pleased to have Georgia's expert opinion on how the campaign went. Just to add maybe a few figures. As I mentioned, this was a pilot, and it was the first time that we had an action of this sort. So I think really the value is also in now we have some figures that can be used as benchmark to assess future competitions. But I think our small effort, we still managed to have over 5,000 people, unique views on our web pages connected to the EU-JAV, and we managed to reach over 10,000 people on social media across both competitions. And also engagement from young people was quite high in terms of comments and likes. So I'm hoping that, as Georgia mentioned, this could give some ideas to people who would like to try out similar efforts in their countries, and really to have a baseline to assess further. So thanks for that.
Thank you. Thank you.
Thank you, Ginevra. Thank you, Georgia. So I will now turn to our last panelist, Dr. Bolette Soborg. So Bolette, I would like to have your perspective on both presentation. First on the healthcare professional training, and after regarding the communication campaign. And as we know, in Denmark, you have a big commission campaign about HPV vaccination several years ago. So I would like to have your member state perspective, if I can say that. So Bolette, please.
Yes, thank you. And thank you for the invitation for the meeting today. First, my comment on the communication and training part. It was a pleasure to read and to follow the presentation, Greet. And we have done very similar work at the member state level, and our findings was about the same. That actually there is a need for further training, and then also that, a bit to our surprise, it's also on the fundamental level of the use of vaccines, whereas we had more focus on the communication part, that how to communicate about the difficulties of vaccine hesitancy or such likes. But actually there was also very much used for the rest, as in you presented in your curriculum. So I definitely think that we can use it, and we will probably adapt it to our context in Denmark. But given that I'm sure that had you made the pilot in Denmark, it would have looked much the same. I'm sure that this would be useful. I mean, one of the questions was, how can you implement it in your policies? I think that's maybe taking it a step too wide. I don't think we will implement it in our policies, but I definitely think that we would use it as a offset for making material for the Danish GPs and nurses and all the other staff that do the vaccination. So thank you. And on your the pilot on the youth and the children, I think it was very fresh and very interesting to see. I think, was it, you can answer afterwards, Genevieve, whether this was all organic reach, because we've made a very big communication campaign in Denmark on the HPV side. And actually it does take a while to build up a follow base, but actually when you do, they are quite, of course they need material to interact with. But if you do that, actually we have, together with our cancer society, our Danish Cancer Society, actually kept that going on Facebook for years. So we're closing it down now after, I think, 4 years in the following, the immunization week coming up. So, but that has been a tremendous success. We've never done anything like you mentioned with contests among children, and I think it's a very interesting idea, and to be able to engage, because we've made more of our content is made for the parents who do the decision of the HPV vaccine, not for the children themselves. So maybe we should dig into that and try to make more of a be on in eyesight with the children, and look into whether this would be useful in the future. We are not able in Denmark to use, as you do, you have prizes and stuff, and I think that would not be ethical, acceptable. So I think coming from us, so I think we have to abstain from that. But thank you.
Yeah, of course we have to adapt according to the social cultural context. It's true. Do we have any additional comment from our panelists or from our speaker, Ginevra or Grit? It seems not.
If I can make a final or a comment final for our, it's what our dream in the far future is that we can take the curriculum, and that we on each item can link trainings that can be as a toolkit for all trainings developed for healthcare providers. That would be the ideal situation, so that when a healthcare provider has a question or want to have a training, that it goes to a certain website and find the links to this curriculum. So if this is the dream that we have in the future for this outcome on training, because we also want to avoid that you have a bunch of training for healthcare providers, so that they have to follow hours and hours on training. This is not the idea that we have in mind. It would be a very dedicated training, and that they can come and pick the part that they needed and that they want to follow. So that's what we want to have in the future, if we have extra funding to create this kind of trainings. But it's a dream.
No, it's not a dream. you will succeed. Thank you very much, our Ginevra, Great, and
sorry,
our panelists.
Sorry, if I may add last comment, just to thank Bolette also for her kind words and for finding this our presentation, our competition like fresh. And maybe if I can add a few words about how we use social media to promote the competition. So in the first case, as it was addressed as school-age children, we decided to do this, let's say, public voting step. We thought that it would be mostly the parents being on social media, because I mean, actually these days children are also social media everywhere, but at the time we thought there will be mostly the parents kind of doing the voting. So we did so mostly on Facebook and Twitter, and it was all organic content. And I think it was because of the public voting that our follower base grew, and also that we kind of had quite a lot of traffic directed to the EU-JAV website, as well as our own, including the European Code Against Cancer page. And then in the second instance, we did make use of paid boosted posts, so-called boosted posts on Instagram, as the audience was towards teenagers and university students, and that helped a lot. So, but I must say that I use boosted posts in my job quite a lot, and there's always kind of mixed results. So it very much depends, and maybe also Georgia agrees with me, it very much depends. But for the 2021 competition, also because it was, I guess, still pandemic times, people were quite a lot spending time at home, so it was easier for them to just scroll through their walls, and that's how we did it. And in terms of prizes, it was a bit, the issue was that, of course, we had to find something that will be supporting our public health messages. So it couldn't be money really, because we give it to the children. So in the end, we opted, and also the winners were across the whole WHO region. So it was something that we had to post. So in the end, we decided to, our prize was gift vouchers for sports, for different types of sports stores in their own countries. And that kind of, I think, was more or less in line with what we were trying to achieve in terms of promoting health supporting public messages. So I wanted to clarify. Thanks.